Okay, folks, we're going to get started. So thank you all for attending. I'm sorry about the link. We just resent that email, so hopefully more folks will be showing up soon. But we thank you so much for being here on this beautiful evening and choosing to spend your time with us here on Zoom. My name is Marissa DuPont. I am the campaign manager for Lisa Arnold, who is running for state rep in 17th Middlesex. She will be moderating this event. So I will introduce her. She wants to have a broad range, impact on a broad range of issues that are important to the residents of Lowell and Chelmsford. Lisa plans to improve access to care for mental health and addiction services, call for a bold and immediate response to fight climate change, improve public transportation, including bicycle and pedestrian access, address the affordable housing crisis, and more. She holds a bachelor's degree in psychology and a master's in quality systems management, and has held multiple leadership positions at a Fortune 500 company over the last 20 years. As chief of staff, she has been responsible for the management of a $1 billion budget, as well as a growing business. Lisa specializes in helping teams get things done and is ready to get things done in the Massachusetts State House for the residents of the 17th Middlesex District. Lisa, take it away.
All right, thank you, Marissa, and thank you everyone for attending. I'm really excited about this opportunity. Mental health is one of the core pieces of my platform. I have family members who have suffered from mental illness, and as a family member, I understand what other family members go through as they're watching their loved ones deal with mental illness and trying to get the services that they need, and as family members trying to advocate for our loved ones. And it's something that we need to improve. It's never really been, mental health access has never really been good, and I think it's become even more apparent now as people are isolated, and being able to get services is going to be very important going forward. So I want to make sure that that's something that I focus on with my platform. My sister, when she was in the hospital at one point, I recall the doctors wanted to change her medication, her medication for her mental illness, and they did not. They were going to do it without first consulting her doctor, and she was in a panic and called me and said, you know, this isn't right. I feel like I finally got my disease under control, and now the doctors want to come in and change everything without asking. So I was actually, because I was the person she reached out to, I was the person I had to get on the phone with her doctors and ask them to stop. It was on a weekend. I said, do not make any changes to her medication until Monday, because you haven't been able to speak with the doctor. And the fact that I had to step in and make that call for her, because she wasn't in a good frame of mind to feel like she could be strong enough, I shouldn't have had to do that. The doctors should have been doing more to understand where her position was. And those are the kinds of things that I think we need to improve our mental health services so that we don't need our loved ones to step in, and that people can get more consistent care. There's a lot of bills in the State House now that have passed through the Senate that the House hasn't looked at yet, and I would want to make sure that all of those pass. So that's something that's important to me, and why I wanted to have this town hall. And I wanted to have it this month because it is Mental Health Awareness Month. So there's a distinct focus on mental health. So this is why I'm having it now, but it's an important issue year-round. So without further ado, let me explain the format a little and then introduce our panelists. So each panelist will speak for roughly 10 minutes. I'll introduce them, and then when they're done speaking, we will take questions. So if you have questions, feel free to put them in the Q&A. Don't put them in the chat because we might not see them. Put them in the Q&A, and then we will be able to ask your questions on your behalf. So with that, let me introduce our first panelist, which is Alicia Page. She has been receiving mental health services for over 45 years. After several years of treatment for her mental illness and addiction issues, she landed at Tewksbury State Hospital in 2004. She was introduced to the Renaissance Club of Lowell upon discharge, and it saved her. She immediately took on the responsibility to be a team captain for the NAMI walk to support the National Alliance on Mental Illness of Massachusetts. And later, at a bowl-a-thon fundraiser for the Renaissance Club, the president of NAMI Greater Lowell asked her to serve as vice president, and she has been in that role for 8 years. So welcome, Alicia.
Hi, greetings. I hope you can hear me all right. Good evening. I'm here in Lowell, where I live, downtown Lowell. And as Lisa just stated in my little bio, I have been receiving mental health services for a great deal of my life, the majority of my life, in fact. I am still in treatment. I still am under the care of a psychiatrist who does medication management. I see a psychotherapist who helps me with behavioral issues, choices, relationships, goals, and I also receive Department of Mental Health benefits, which are very valuable, and I will provide the number for the department, the local Department of Mental Health, which is state-funded agency, later, and that will be available, I believe, when the audio is recorded and sent out. In any event, these services are very good, and what I will talk about briefly is I'm going to refer you to NAMI Massachusetts. It's a very good resource. They provide a great number of groups. I'll read them briefly. Family to Family is a free 12-week course for families, partners, and friends of individuals with serious mental illness, and it's taught by NAMI trained family member volunteers. And in fact, basically the mission of NAMI is to work with their 20 local chapters, which are called affiliates, such as the one I'm vice president of, the Greater Lowell affiliate, to improve the quality of life, both for people with mental illnesses and for their families. And frankly, NAMI was started by family members. It was a coalition or a small cadre of family members who were just getting together in a kitchen and talking like, what can we do? How can we help? Oh my God, it's a crisis. Where do I go? Where do I find resources and direction? Eventually, it became the National Alliance on Mental Illness, formerly NAMI, a national organization, and there are state-level organizations such as NAMI of Massachusetts. And then there are affiliates such as Greater Lowell NAMI. I don't know if you can see that, but that's our affiliate here in Lowell. We serve Billerica, Chelmsford, Drake, Dunstable, Lowell, Tewksbury, Tingsboro, and Westford. And I think we're trying to get Andover in there too. And we were moving on to, I'm going to finish with the programs of NAMI Mass. But really, your best bet to get totally educated about NAMI is to go to the NAMI Mass website, which is simply namimass.org. And I'm just going to read the NAMI basics in our own voice, family support groups, NAMI Connection, a number of support groups and some educational groups that are done virtual at this point. There's also on the website descriptions of mental illnesses. There's a Compass resource and referral helpline that's still being answered virtually. I can't talk enough about the educational and support and advocacy resource that NAMI Massachusetts is. And just briefly about my affiliate, Greater Lowell NAMI. It was founded in 1986. We are a group of concerned individuals responding to the tragic neglect of our mentally ill citizens. We address local area problems such as hospital facilities, housing, available treatment and aftercare. And our sharing and caring meetings provides compassionate support and understanding for all our members and for anyone else seeking this support. And in here, it fundamentally says the family support group, which we do run, it's in the third Wednesday of every month, is anyone who is interested in the support or advocacy of the mentally ill and their families is welcome. So the thing is, NAMI, the Greater Lowell affiliate is kind of coalescing. We have a new location, the Solomon Mental Health Center, which has been there for decades and eons, located just past Lowell General on Varnum Avenue, has closed, and that's where we used to meet. So we're going to be meeting at the Chelmsford Public Library starting, we don't know when. But we're trying to build our membership, we're trying to reach out, we're trying to get on the cable stations, just get the word out that we're here. We're here. We're here for families. We're here for consumers, people within individuals seeking services. So that's kind of that about NAMI in general, NAMImass.org. We don't have a website for NAMI Greater Lowell right now. I'm going to briefly talk about the Renaissance Club. Try to find a nice picture on the front, which is right there. And here's a lovely, beautiful picture of me. But anyhow, I'll just briefly tell you about that. It is funded by the Department of Mental Health and fundraisers and donations. It's marvelous. As Lisa was telling you, when I was hospitalized many, many times, that event, and eventually that state hospital in Tewksbury State Hospital, wasn't fun. Don't end up there. You don't end up there when you're doing well, and I was not. However, when I was discharged, or I was segued to the Renaissance Club, even as a patient there, and here's it is. Renaissance Club House, a program to evaluate community human services, serves adults with mental illness in Greater Lowell. Renaissance Club provides a supportive community for individual recovery from mental illness. Our community is a safe place where members can form lasting relationships with others and build on those relationships to become more vocationally and socially active in the clubhouse and in the world. It is a place to come, a place to return, a place to develop meaningful relationships and create meaningful work. And indeed, it is all that. I can promise you, mental illness recovery is very nonlinear. I have bipolar disorder. I take medication, absolutely. And I need to continue, I need to stay focused on positive recovery. And I try. But like I say, it's had its ups and downs. It's been nonlinear. However, that place to return, place to belong, place to come back to, people are there. There's been a lot of consistency. Renaissance Club has been in Lowell for 52 years, I think 53. They had a gala 50th event at Lindsay's a couple of years ago. So in any event, that's a great thing. Then one thing that people need to know about in any event, if you're ever in crisis, you dial 911 immediately if you need to. Otherwise, there's what do they call themselves? Emergency Services Program. There's one in Lowell. It's now, it was at Solomon Mental Health Center for a long time in a little enclave there. It's closed. It's down on Bridge Street, and it's monitored, or it's commandeered by Leahy. So right now it's called Psychiatric Crisis Team. Leahy Behavioral Services. And finally, I think that might be about it. I just hope that's been helpful. My story is my story, and a lot of people have stories. But the Department of Mental Health has a contractor called VinFen. You used to have basically two contractors in Lowell, Mental Health Associates and VinFen. And VinFen provides supportive services to its clients who are all DMH, all have DMH benefits. I received DMH benefits when I was hospitalized right before I went to Tewksbury, like around the end of 2000, like in October of 2004, I was hospitalized in December, out in March. Praise the Lord. A lot of people spend a lot more time institutionalized, and I did not, fortunately. But anyhow, lost my train of thought. Sorry. In any event, I just want to say that VinFen, this contractor, is excellent. It's 4 teams serving, I think, about 400 individuals. The teams are comprised of a director, assistant director, social worker who does a treatment plan, outreach workers who help implement the treatment plan one-on-one with each client, peer specialists, a very important part of recovery now. These are individuals who have lived experience of a mental illness, addiction, or both, dual diagnosis, and they're very effective, very hard workers, very available to the individuals on their team, and then the administrative staff, and I think I got it all covered. Ren Club is unit organized. staff very available to talk to. That in the city, there are also some day treatment programs. I'm not going to go into the names of all the clinics. There are several. And I don't know how much time I have left to talk or if I've even gone over. I think maybe I've said enough. I'm not going to give out my individual number, but you might be able to reach me through Lisa or Marissa. But I hope that's been helpful. Information and numbers will be available later. Thank you very much.
Thank you, Alicia. That was great. My family actually took advantage of the NAMI services after my first sister passed away. And it was very helpful. So definitely, if you're not familiar with NAMI, I highly recommend it. It's great for support for both the individuals dealing with mental illness as well as their families. Our next guest is Michael Berggren, who sought a new direction into the world of peer support with the Northeast Independent Living Program's Recovery Learning Community in 2015. Prior to employment, he was unaware of the role peer specialists play in the landscape of mental health, substance abuse, and trauma recovery. During that time, he has come to see how vital lived experience can be. Carrying a message of depth and weight, a peer specialist can relate to any given feeling, regardless of the difference in life situations. He is privileged to count himself a team member of the NERLC and an example of how adversity truly introduces us to ourselves. As hub manager of the Greater Lowell and Essex North areas, he hasn't forgotten where he's from, nor does he forget that he stands on the shoulders of humble giants. Without his team, he would not be here today. Aside from the work, he is a proud cat dad of Lemmy, a 9-week-old kitten. Welcome, Michael.
Good evening. Thanks for asking, reaching out. This is great. It's always a great topic. And yeah, I work, so the larger agency is the Northeast Independent Living Program, and our team is the Northeast Recovery Learner Community. We cover 69 cities and towns. We span from Acton, Arlington region, up through the Merrimack Valley. So I basically handle, Greater Lowell, Essex North, and then down through Gloucester, the Metro North. So we cover a large area. And, we're a DMH-funded program, so it's nice. We have a contract, right? But the nice part about the contract is it's very open-ended, and we're able to sort of operate in the ways in which we would want. And, with that, I think the important part is knowing that, like, I'm not constricted the work I do. Like, I jumped into this role. I'm from, AA. So I have a very confined view. I started this position when I was like 6 months sober. So I come into this role and I'm going to save the world. And what I learned about peer specialists as I went through the CPS training a few years back is that it's such an open role to play, because it could be a change agent. I'm a very defiant person. I'm disobedient regardless of being a person in recovery. I don't even like the word recovery. I just, it's a word. How else do you define yourself? But it is so much deeper than that. I live my life. That's it. And really what we do is, beyond the peer support, the one-to-one, the group setting, activities and things like that is, we really have kind of opened up training in the arena of training. And it's a training called Recovery Foundations that is essentially a pre-certified peer specialist training, basically teaching people what the role of peer support is. And then it's not just about being a CPS. There's intentional peer support, which members of the team could explain much better than I can. But, it's just another opportunity. There's RAP facilitators, which is Wellness Recovery Action Plan. You could become, I'm a smart recovery facilitator. there's just so many things that you can do beyond just, being isolated into one position. I came into the CPS role, and I didn't know what it was. And it's amazing, So in Lowell, a lot of what we do is, especially recently, is, with everything that's going on, yes, we moved a lot, or majority of everything, to Zoom, and we hold, groups and activities. A lot of one-on-one phone calls, a lot of those phone calls, and opening up that way. But we've also, prior to COVID, we were invited to attend the mental health court in Lowell and sit and sort of watch how the justice system handles individuals that, prior to incarceration or who have been incarcerated, what it's like for them. And the ultimate goal is to actually, try and get to know individuals in that capacity. I have plenty of experience with that. I've been incarcerated for a decent majority of my life. And so I know what reentry looks like. And so, we're gonna, a big part of us is gonna be reentry. It's a big deal to me. When I think of mental health, people have the sort of general definition of what it is: wellness or mental illness, or no, man. Like, I look at the world and I say, oh God, I'm glad I'm not a normal person. Like, I'm glad I'm an alcoholic, like a drug addict. Like, I'm glad I'm like absolutely, insane to the core, because I look at people who, have a seemingly normal life, and I'm like, no thanks. Like, you're hoarding toilet paper. Cool, man. Like, no. So if that's normal, no thanks. And here's the thing: is like we work with, pair with clinicians, and we pair with, the justice system. We pair with recovery coaches. We do whatever we can. But the ultimate goal is to help an individual see that beyond a diagnosis, beyond substance use, beyond trauma, beyond all those things and characteristics and labels, is an actual human being. And the actual human being might want something to do with their life beyond just, having goals set for them rather than with them. And that's essentially what we do. And I love the role because we work a lot with the homeless population. It's vital. Substance use is that's my, just as I said earlier, I'm a big 12-step person, but I'm very open to all formats. I couldn't care less how you get into it. Doesn't matter. I am definitely not one of those closed-minded, 12-step people. And the idea is to be a part of the community, to actually be visible, and to go to the places, to go to the tent cities, to go under the bridges, to invite a person who has just been released from the House of Corrections in Billerica, like to invite these people in and to actually establish a connection in the community. A lot of the work we do is predicated upon just meeting individuals where they're at. That's it. It's not about fixing. It's not about changing something that they don't want changed. A lot of the programs, we do community bridging through Tewksbury, which obviously now has been postponed indefinitely because of what's been going on there. But the idea is to bring people out of the hospital setting in a comfortable way on passes, and actually introduce them to the resources in their area that they're moving to. Older adult peer support. That's a huge, Joanne Wolf, who's going to be the manager of that, opening up an entire sort of part of the agency that just deals with older adult peer support, having certified older adult peer specialists, which is really cool. And then I go with the sort of reentry and the training. So, we really just want to, invite individuals that, the amount of health disparities and the social determinants of health, when you really look at it, cities like Lowell are affected in ways that cities like Chelmsford aren't, or Andover. You go to Lawrence, well, people used to be very afraid. People still might be afraid to say, oh, I want to go to Lowell. Lowell's not that scary of a place. You know, Lawrence isn't that scary. But yeah, do bad things happen? Sure. But the theme behind it is, you know, who lives there? You know, what's the population? What's the demographic? And so we go to these places because that's where people may just need to have someone listen instead of tell them what needs to be done for them to have a life, right? Because I don't know, I barely know how to manage my own life, let alone yours. So I'm not going to tell you what to do. And so we try to look at where the gaps are and provide support to individuals that fall through those cracks. And it really doesn't matter where they come from. It doesn't matter, you know, if they have services. You know, honestly, we prefer that they don't, because we know those individuals need it the most, you know. There's nothing wrong with mental health services in any way, shape, or form, but, you know, the way in which the system has existed for so long is like, I can't fathom what a person of color, you know, how they would try and maneuver the system that for so long has either looked down at them. I mean, the historical racism involved in the mental health system is absolutely atrocious. So, you know, I'm a white guy from Boston. Like, you know, I'm just, you know, I am what I am. It's not to say I don't get it. I understand the mentality. You know, I've been in those places. But the truth is that, you know, we try to look at the person as a whole. And, you know, we were talking about it today at our team meeting that, you know, this is something we really want to do, especially with justice reform, because, you know, statistics for years have stated, most individuals that are incarcerated have some degree of either mental health challenge, trauma, and substance use. You know, substance use especially. You know, with the opioid crisis that's going on, trust me, locking somebody up because they've had some fentanyl in them, because they had a little bit too much, they had distribution weight. Let me tell you, if I'm out there running, I have distribution weight because I need to use throughout the entire day. It ain't because I'm trying to sell it. It's because I need it, because I'm going to be fiending at some point. I'm going to get so sick that I'm not going to be able to do anything. You know, that's what it's like. And here's the thing is, like, individuals don't, if you haven't been there, you don't get it. And it's fine. You know, it's absolutely fine. But that's why talking to police, talking to law enforcement, talking to the justice system is so vital. And sharing that experience. You know, I've been privileged to be able to do that and to speak to law enforcement about my experience, because, man, I couldn't care less. Like, you look at me, you don't like it, tough. You know what? It's my life. And people are dying over this. In a wide variety of ways. People are dying due to the complacency and the complicit nature of this culture. And it's disturbing. And so being a peer specialist, using that change agent angle, absolutely. You know, that's what we're here for, to step up and actually speak for those who don't have a voice. And then when those people do have a voice, let them weaponize it, you know, let them put it out there. Because it's their story that counts. It ain't me. I'm not speaking for anybody else. I can't speak for anybody else. That's not my job. That's privilege, you know? You know, so with that, you know, I'm grateful that, you know, I get to talk about this stuff, because it's a passion of mine. At one point, this certainly was not. You know, it's amazing. It's amazing. I'm a hub manager, and all that means to me is, like, the places that I've been in life, I've been homeless, I've been incarcerated, I have hit the bottom with drugs and alcohol, I've been and seen, you know, the worst things, and none of it affects me today, not 1 ounce of it. So that's what I hope for everybody that comes into this way of life, because that's what it is. It's a way of life. So I'd like to thank you again, and with that, I'll shut my mouth.
Thank you, Mike. That was great. I think the work that you're doing is really important. So I'm glad that you agreed to speak with us and kind of let people know what it is that one more program that's out there. It's very important. I want to welcome a few more people. Thank you for your patience in getting into this meeting. We are trying to get the link out there, and we still have one more speaker and some Q&A. So our next speaker is Lindsay Kilile, who is a licensed independent clinician social worker specializing in children, adolescents, and family work. She has been a practicing clinician of Family Associates of Merrimack Valley since 2008. Lindsay had been a special education social worker since 2006 in various school districts, most recently working for the Lowell Public Schools. She is currently the coordinator of social emotional learning for Lowell Public Schools. Lindsay resides in Chelmsford with her 5-year-old daughter. Welcome, Lindsay.
Thank you. Thank you for having me, Lisa. So I guess I'm following a couple of acts that were great. Thank you for Mike and Alicia bringing up a lot of points regarding mental health. I think I'm coming at it from two lenses, one as a provider for the mental health field in Chelmsford at Family Associates, and the other from Lowell Public Schools. I think the things that we touched on and that Mike most recently touched on was substance abuse, any physical abuse, as well as mental health. And in the Lowell Public Schools, we're really trying to start these initiatives so that we can create foundations with our students at a young age to make safe, sound decisions that are going to help promote them for being healthy. We're doing a lot of awareness right now around social emotional learning. And I guess what I was able to say to Lisa most recently was, the silver lining with this pandemic is people are really wanting to hear more about social emotional learning and mental health as they go hand in hand. So social emotional learning is really teaching skills of how to handle these coping mechanisms around diagnoses and mental health. So if you're a parent or family member or grandparent, as well as I think really what Lisa's talking about, breaking a stigma. It's very challenging in a school system to be labeled based on a diagnosis, based as a SPED. I hear all the time, my population's reaction is very negative towards that, and usually it's a lifelong stigma for these students. So I'm going around, I am trying to raise awareness about that we need to say it's okay to not be okay. And how we can lend a helping hand to those in need, whether it's seeking help, being able to talk, or looking at preventative measures in a public school setting. Am I too short for everybody? I'm sorry. I feel like everybody said a lot, and so I just want to open up for people. So maybe I need to be really like running another 20 minutes, but I figured I'd rather talk to people that are here.
All right, I think I'm unmuted. Why don't we go ahead? Are there any questions? I don't see any questions in the chat, but if people have questions, we'd love to hear from you. Oh, I saw one just pop up. Let's see what we got. What are some of the social emotional learning initiatives in the Lowell Public Schools? I think that's for you, Lindsay.
Oh, great. So when we're looking at the school system, it's really a tiered model. So for those that work for the elementary level, we're working on open circle model. And then as we progress to this middle school or a K through 8 on the older end, we're looking for a second step. And these are all on Castle's foundations for social emotional learning, which is actually in conjunction with the DSE. And then in the high school, we're actually looking at purchasing a new assessment tool. It's called the DESSA, D-E-S-S-A. And so what I'm really excited about this tool is we're giving mental health a number, which I know people have not always been keen about, but the fact is I need to say it's tangible. And so for parents and community partners to take mental health seriously, when I have a student that's following an at-risk number of under 40 with the DESSA, I'm able to say, we had this assessment school score, we did the rating, I need you to take this seriously, as well as then we're able to put in resources and then rescale them again to say this either worked or it didn't. So The one thing that I think is really the takeaway from this, I was on a Zoom earlier with the Boys and Girls Club, and they showed an amazing video about resiliency. And so one of the things that I took away from it was that we have such a medical profession that believes in physical health. And, you know, I don't feel like mental health gets the same credentials, right? So I need someone that has a broken leg to come in and get the accommodations and support in school is same as someone that has a mental health diagnosis.
Great, thank you. I have a question that I'd like to pose to all of our panelists. Would you say, has the demand or the conversation, I know Lindsay, you touched on this a little bit, changed at all since this, the pandemic are closing things down and the social isolations coming up? What have you seen that's different? If each of you could spend a little bit of time talking about that.
As a provider, I'm obviously using telemedicine, which is a convenient way for people that I think that are struggling now and really needed to find a provider to say, I'm isolated in my home, I'm having more depressive features, or maybe I'm at home with 5 kids and I'm not handling my stressors as well. So they're able to find us clinicians and do telemedicine, which is much more convenient, as well as keeping up with our clients without being able, having to have exposure going to the office.
I'll speak to that also, if I may. Yes.
Good.
Okay. It's had a profound effect on me, individuals I know, the president of Greater Lowell NAMI, and a lot of people I know who are in the system, DMH clients in the system. They receive benefits such as SSDI, Social Security Disability Insurance, SSI, Supplemental Security Income, Medicare, Mass Health, food stamps, et cetera, et cetera, et cetera. And being in the system may sound great with a lot of entitlements. It's not all that great. The thing is with VinFen, that's usually a lot of one-on-one contact. Like Mike was talking about, peer specialists are available. It's one-on-one, it's very personal, you share a lot. We don't have any one-on-one or face-to-face contact with our providers right now. I saw my psychiatrist last week through telemedicine. She's a bit fierce. She said, "You must check the text." There I am. I was outside, but it was telemedicine. But in a way, it was super effective. It was super effective. I also go to AA. I'm a recovering addict, and those meetings have been virtual. And there are assets and there are pluses and minuses. You know, the pluses is it's Hollywood Squares. You don't have that feeling of like everybody's feelings around you and the energy of other people like right there at a big meeting or something. So my point being, is challenging. People who rely on VinFen for rides to the grocery store now have to put the money in an envelope with a list under their door. VinFen outreach workers say has to collect the money, blah, 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 bring it back, slip it under the door, deliver the groceries, just like curbside delivery is. And that is fun. That's challenging to a lot of people who don't have cars, and a lot of consumers don't have cars. The buses now are free but limited. What else? Uber is whatever. People have different strategies. I happen to own a car. I'm very blessed. And some people are homeless, and some people are looking for housing, and it's challenging for anybody at this time. The president of Greater Lowell NAMI, who isn't with us today, I called him to see how he was doing. He's very lonely. His daughter's in a group home. He hasn't seen her in 2 months. Typically, he would see her for a big Sunday afternoon meal, check up on her. He's a Raytheon engineer, retired. He's used to being super busy with church, and he's just, people are not doing what they used to do unless they're working from home. I have a lot of free time. I happen to have like redecorated my place or something. It's, for me, at first the pandemic was like, oh good, this is an excuse for my do nothing life. Hallelujah. Not a very good attitude, rather evil. But now it's like, okay, this is a time to slow it down. I've had a time to have introspection more and more and just slow it down. And with bipolar, you can get very racy and all over the place. So for me, and I think for some others, it's been an opportunity. I mean, obviously it's a public health emergency and it's terrible, lethal, and major problem. I'm trying to give, there's no real pro to the pandemic, but whatever. The Run Club, the Renaissance Club has been closed. The staff are still there, maybe about six people who are unit coordinators. It's unit driven. You can look it up if you want more information. I'll provide the number tomorrow.
I do have a couple pros.
They make a meal. They make a meal and they deliver it every day. Thank you very much.
I have to say a couple of my pros is usually I'm dealing with students that don't want to go to school, and I can't tell you how much they appreciate going to school now. So I do want to like keep it a little bit light in the, again, like there are some great things, like when I'm in a school system, especially in middle school, and they're saying, I don't want to be up this early and I don't want to be here in homework, and I'm Zooming them and they're like, Mrs. K, when can we come back? And I'm like, oh, we're singing a different tune. So I think like kids are realizing, as well as parents are realizing, school systems provide much more than just academics, right? And so they're right now at this point, we're doing about 7,000 to 9,000 meals. We're doing 9 sites for Lowell Public Schools where we're giving meals. We're also giving SEL packets. So we're talking about when you're home, since your kids aren't with us, help us teach these important resources. We have a webpage dedicated to tools. I also did a rework on Netflix movies. Everybody's on Netflix. My kids are on Netflix. So I'm like, let's use Netflix to our advantage. So I put up movies that I feel like will provoke honest conversations with families about mental health, and how to talk about feelings, how to talk about difficult things. So although yes, the pandemic is destroying a lot of, social interactions and that type of thing, I think it's brought out having a lot more of conversations about mental health. And honestly, I feel like people are much more supportive towards other people because of this time.
Yeah, I mean, I don't have much to add except to basically echo the sentiment shared. I think the overall theme that I hear is that people are far more vigilant in their own lives, looking inwardly, because that is so vital. I mean, there have been just from what I hear, and people in circles. There's been a number of overdose deaths. I know that, and death by suicide as well. And that isolation is, I look at it. I was made for this. Like I was made to be. I'm not antisocial by any measure, but I am like a positive nihilist, I guess you could say. So like I sort of I can adapt very quickly to not being around people. I'm cool with that, but it's refreshing to go outside and actually see just another human being, even if they're a block away. And I think it's so easy to forget how hard it can be to live this life and have these things going on. Inside my head, everything, I don't have a drinking and drugging problem anymore. I'm an alcoholic because my center's up here. And that's the same for everybody that I know that's in some type of recovery. Like it's the same. It's, and so it's so easy to forget how difficult it is. So we work with a lot of people that are very early in recovery right now, and they are literally gritting their teeth each and every day because there's really no options, but the positive is that I know a lot of people in early recovery right now that if you can stay on an even keel through this, there's really nothing that's going to touch you at the end of the day. I mean, this is, the resiliency of individuals that have, challenges, problems, whatever you want to call them. They're assets. They're at the end of the day, they're all assets. That's what, as I said, I'm grateful. I'm grateful to be, and that's what I see with a lot of people. That's the thing. So that's a big pro for me is I see the gratitude that is just bursting at the seams with people just to have what they have, I don't need what I want. That's never going to be satisfied. And that's the sentiment that I hear. People are just grateful. That's it. You know, it's amazing. So.
Great. Thanks, Mike. There's 2 more questions, and I want to be respectful of the time. I know we got started late, but I do want to be respectful of the time. One of the questions is for me. I will answer that, and then the next one is for Lindsay, and I will pass it over to you. The question is, what are my current plans to help improve awareness and mental health assets in Greater Lowell? So this town hall is the beginning. We've asked all of our panelists to provide us with resources, with links. You will be getting information about that tomorrow in a wrap-up email for anybody who signed up. So we do want to share this. I think for me, the best thing that can come out of this is that we talk about it, that we end the stigma. I would like nothing more than for the dialogue to be that it's okay to talk about mental illness. It's okay to not feel okay. It's okay to be vocal about it. So I think if we can continue the dialogue and we can continue to talk about this, I feel like I will have been successful. So, and in the State House, that's one of the things that I would really like to continue is let's just talk about it as though it's no different than cancer or no different than kidney disease. This is a disease that eats away at a person's brain and changes the way they think. And we need to think as a population about mental illness in that way, because that's exactly what it is, and there's no reason to be ashamed of it. And we need to get people the help that they need to get. So that's kind of my hope for this and for the future. Next question, Lindsay. How can the system deal with a student or teenager who is academically brilliant and can ace any test or manipulate any counselor, but at the same time displays significant behavioral or emotional problems?
Well, it's funny that when we talk about this, because I know we usually say manipulation in a negative way. I would try to see what way can we frame it into a positive way and how can we play into their skills. So most often, students that are displaying those behaviors are bored. So we need to talk to schools about, can we get them additional curriculum? Can we get higher level curriculum? We need to activate the positives that are happening. And if they're above and beyond their population, then we need to play to their tune in order to increase their engagement and therefore eliminate some of the behaviors. Sorry, my 5-year-olds. But I think talking to your school guidance counselor, talking to your administration, hold on one second, sorry. Talk to the administration about how can we tailor some curriculum. Mommy's on her call, I'm sorry. Curriculum to their individual needs. So being a special education social worker, everyone thinks, well, you need to have a disability or a diagnosis to have an IEP. And part of the things I'm trying to change in Lowell Public Schools is everyone has an IEP. So everyone gets an individual plan that we're going to give them the accommodations and resources they need to have the highest level of achievement. So we just need to play to each student's strengths. Sorry for the interruption.
Thank you, Lindsay. That was great. So thank you to all the panelists. We are at a time where I would like to give everybody just a quick 1-minute wrap up of something that you'd like to say. We are going to collect resources, and everyone who's on this call, everyone who signed up for this call will get a list of the resources, and I'll have them available on my website as well. So I want to thank everyone for being open-minded and coming here to hear what we have to offer here in the Greater Lowell area around mental health services. So thank you all. Last words?
Recovery is real.
Yeah. I'm just so glad to be a part of this, and I just hope people can keep talking about mental health.
Right on.
Thank you for letting us be a part of this, Lisa.
Yeah. Thank you very much.
Thank you so much.
All right. Thank you, everyone who dialed in, and apologies again for the mix-up with the link, but I'm glad you were able to join us. So feel free to continue the dialogue. We're open to hear whatever you have to say, and we'll see you someday on the streets.
Thanks, Lisa.
All right, take care.
Bye, all.